We serve folks primarily under 30% AMI, primarily coming out of vulnerable situations like homelessness, adults living with severe and persistent mental illness. The type of housing that we provide is called supportive housing, and I think most people don't really equate that with affordable housing and don't really know what that looks like. You know, they have images of supportive housing being group homes or ALFs or treatment centers, but supportive housing is a form of affordable housing. It's affordable housing for vulnerable populations with on-site supportive services. And in a lot of ways, the model of supportive housing, which has been around for many decades, has really been on the forefront of the idea that housing and health live together and are important components to have in affordable housing. We provide some of the services ourselves. We have service coordinators and clinical staff that's part of Carrefour, and we provide those services on site ourselves. And we also partner with other organizations that come on site and provide behavioral health and primary health care services. I saw Pauline from Better Way. They're one of our behavioral health care partners. They come on site and they provide recovery support services and other behavioral health services.
I just did some back of the envelope in terms of how much subsidy we need to solve a problem like that. And I think with the close to 135,000 units that we need, it would only take about $50 billion of subsidy to solve the problem in Miami-Dade County. This is not a problem of we don't know how to do this. We don't need many studies. The nonprofits here in the room that I work with across the state and across the country, they know how to build this, they know how to run them. All they need is money to do it. And whether we get the money through taking a haircut from the healthcare system, or we ask the hospitality industry to help pay for supporting, there are lots of ways. We don't provide lots of the important subsidy that needs to go into projects, but we do try to provide flexible loans that people can use. If this were a problem that the banks could solve, if you had a project that was attractive to the banks, we typically work in those areas where the banks don't find these attractive for whatever reason. That really speaks to the interdisciplinary understanding that other organizations have in the value of housing as a way to affect social change. You know, we work in low-income communities, and of course, low-income communities typically correlate pretty highly with people of color. But we just wanted to have some more data around that. And so basically, this gives you just a little understanding of where our dollars and our loans go into, and it is very, very highly concentrated into BIPOC communities. They are also building a children's education center right across the street from this. I mean, they come in, this is 100 families here, so it's usually maybe 150 kids that are at the shelter at any one time. And so we're moving forward with a new markets tax credit investment in that.
For those of you who aren't familiar with Dade Heritage Trust, we're a 51-year-old historic preservation organization, and our mission is to preserve our community's architectural, environmental, and cultural heritage through education and advocacy. I think our organization is doing some of the most important work we've ever done. And this is preserving historic multi-residential buildings, primarily in Little Havana. Getting into the preservation of naturally occurring affordable housing was nothing I ever imagined, and it really happened serendipitously. Back in 2017, the National Trust for Historic Preservation deemed Little Havana a national treasure because of its rich immigration history and because of the incredible historic building stock. So working with the National Trust, we commissioned a study called Little Havana, Mi Importa, and we worked with a local planning firm to look at Little Havana in a holistic manner. How could historic preservation impact health and housing and historic preservation within that neighborhood? This was our first project, a beautiful 1935 Art Deco building on Southwest 5th Street. The photograph on the left is the way it looked when we purchased it, and this is the newly renovated building on the right. The average rent in this building is $950 a month. And the buildings, I know, it's beautiful. And this program has created such a sense of pride within the tenants and a sense of understanding that they have a landlord that actually cares about them. And because it's obviously our intention to maintain these buildings to the best ability, right? To be a showcase for the neighborhood. And I'm going to tell you, this building has had an impact on our intersection. The people across the street have painted their building. They've installed new windows. The people adjacent are renovating their building. And so we see what this work does within this neighborhood. It's a 1938 Art Deco, 4 units in the front, 2 additional units in the back. And this building, I think, really speaks to what we do. These tenants this building was so neglected that on a daily basis I'm getting calls because they now realize that they have somebody who cares about them and that we're going to ensure that they live in a healthy, lovely place, a place where they can proudly raise their families and proudly say they reside in Little Havana.